and lower the fighting ability of the immune system, of the cellular immune system, towards all microbes. There's a relationship also with biotin, and the most important, maybe most important relationship is that with reduced glutathione, the more you're excreting this compound, the more you're losing reduced glutathione, the primary antioxidant in our system, that is sort of associated with life expectancy. The more glutathione you have, the longer you live, the less the cause of all types of death in a population. And so glutathione is today really like the holy grail in our medicine, and having found a reason why Lyme patients have low glutathione, and a simple fixable reason, is a fantastic advance in our field. Well, there's a simple urine test that I mentioned. It costs a little over $50, and it's called the KPU urine test. It's still the old term that's used for that. And we like to do this as a 24-hour urine collection. We're adding 1,000 milligrams of ascorbic acid to the collection container that preserves this compound in the urine. And we wrap the urine container that we use with aluminum foil, because the compound is also light sensitive and may disappear when the collection is contaminated with sunlight or daylight. So this is just a little clinical tip for this. It takes usually about 3 weeks to get the results back. When the levels are elevated, and depending on how much they are elevated, we then proceed to treat this condition. But there is a certain structure that sort of evolved in looking at the different issues that are important here. One is, I realized that probably the most important human issue is the issue of autonomy. That every one of us needs to learn how to be our own healer, how to find happiness, find our own walk in life that is just the right one for us, find our own destiny, which I do truly believe is predetermined. And no therapist can help us finding ours. They can tell us how they found theirs, but they can't really guide us towards ours, because it has to be a very individual path. And so one thing I learned in psychotherapy, that it is kind of dangerous or not helpful to patients to install in a patient my own ideas. I need to learn how to pace the patient, how to see where are they going, what walk are they walking, what is their life about, and how can I help them to find their own without me intruding into their own path. So I was asking maybe slightly different questions in that way than what is commonly asked, at least amongst the physicians and practitioners that I know. So what emerged for me, the first issue that needs to be dealt with in the psychological realm is trauma. That all of us have a trauma history, starting with the moment of conception, the intrauterine time, our birth, the first couple of years in life, which certainly are more significant than anything else that ever happens later in life, but also the grown-up years. I feel the teenage years are overlooked in psychotherapy as a huge stretch of time with lots of accumulated traumata, minor and major. And every trauma leaves a distortion behind in the way we're thinking, the way we're perceiving the world, our attitudes, our beliefs that form around that. And by revisiting a trauma in gentle ways and reconstructing what actually really happened and reperceiving it, reprocessing it, as Francine Shapiro calls it, allows the brain to function in new ways, in different ways, in more liberated ways, leading the client or the patient to have more autonomy over their future decisions. They will be healthier and better.